Dear colleagues, my name is Mekhman Mamedov. I am professor of cardiology from the National Russian Institute of Therapy and Preventive Medicine, which is located in Moscow. First of all, I will welcome all participants of the second Heart Congress, which will take place from June 20 to 22 in Paris in hybrid mode. Also, I express my gratitude to the organizers for the excellent organization of the Congress. The scientific program consists of 70 reports on various topics of cardiology from around the world. I am sure the technology gained will be useful for practical doctors and scientific in the field of cardiology. My report is devoted to the updated European guidelines for the treatment of patients with type 2 diabetes mellitus and cardiovascular diseases. I declare that I have no conflict of interests. Diabetes is one of the most prevalent disease. WHO declared it a pandemic. Today, 8% of adult population suffer from diabetes, especially type 2 diabetes. This table shows 10 countries where this prevalence of diabetes is high. There are China, India, United States, Brazil, Russia, Mexico, Indonesia, Egypt, Japan, Bangladesh. The top three are China, India, and the United States. And in 20 years, this trend will be continued. It should be noted that the diabetes pandemic is observed in the countries of Southeast Asia and South America. In the future, African countries may also enter a high-risk zone for diabetes mellitus, which is primarily due to lifestyle and the quality of food consumed. This picture clearly shows that the countries of the former Soviet Union, included the Baltic states, are at high risk of developing diabetes. Thus, in these countries, the prevalence of diabetes is more than 80%, while in Western and Central Europe, the prevalence of the diabetes is 4-5% among adults. On the other hand, most of the patients with acute coronary syndrome have glucose metabolism disturbance. Euroheart survey, in which 25 countries took part, revealed that 20% of patients with acute myocardial infarction have diabetes. Prediabetes is detected 2 times more often. Need to mark that in some patients the changes are transient due to stress. According to the other multi-center Eurospire study, recently there have been a positive trend in reducing of hypertension and hypercholesterolemia. While the incidence of diabetes mellitus, including newly diagnosed diabetes, is increased. The results of the last multi-center Eurospire 5 study showed that about 30% of patients with cardiovascular disease were diagnosed with diabetes mellitus, while 41% of patients have various disorders of glucose metabolism, including prediabetes. In the classical international Interheart study, among 10 significant risk factors, type 2 diabetes mellitus also plays an important role in the association with acute myocardial infarction. Complications of diabetes mellitus are important, which affect the quality of life of patients and affect the life expectancy. They are conventionally divided into 2 parts. Macrovascular complications include coronary heart disease, heart failure, peripheral arteriosclerosis, other low extremely arteries, and cerebral stroke. The prevalence of these diseases in diabetes patients average from 40% to 80%. Microvascular complications include retinopathy, neuropathy, and nephropathy. Their prevalence range from 31% to 73%. Taken together, macro and microvascular complications accelerate the development of complications and death by 3-4 times. From time to time, international specialized societies regularly update guidelines for the management of diabetes patients and cardiovascular diseases. Latest European updates published in 2023. In addition to the European Society of Cardiology, experts from 9 professional societies took part in the development of this document. What's the news? Several slides briefly present the main points. In the new guidelines, unlike the similar documents for 2019, early disorders of glucose metabolism or prediabetes are not considered. Guidelines are presented for cardiovascular risk stratification, screening, diagnosis and treatment of cardiovascular disease in patients with diabetes mellitus. General principles for the management of type 2 diabetes are taken from the recommendation of European Association for the Study of Diabetes and the American Diabetes Association. In the new guidelines recommend treatment patients with diabetes and the chronic heart failure regardless of left ventricle ejection fraction with GLT2 inhibitors to reduce hospitalization for heart failure. When using the low dose aspirin and the combination anti-thrombotic drugs, the use of proton pump inhibitors should be considered to prevent gastrointestinal bleeding. In patients with diabetes mellitus and chronic kidney disease, treatment with the CGLT2 inhibitors and or firenone is recommended since these drugs reduce the risk of cardiovascular disease and the renal failure in addition to standard treatment. To achieve adequate glycemic control in patients with diabetes and chronic kidney disease, GLP-1 antigens can be used due to low risk of hypoglycemia and positive effect on body weight, cardiovascular risk, and albuminemia. Dear colleagues, the issue of diagnosed diabetes and prediabetes is again actual problem. Currently, a doctor has 3 methods for determining diabetes. They are fasting blood glucose, glycated hemoglobin, glucose level 2 hours after an oral tolerance test. When the fasting glucose level is more than 7 millimole per liter, glycated hemoglobin is more than 6.5% and the glucose level after load is more than 11.1 millimole per liter, diabetes is established. When the markers are at borderline levels, prediabetes is implied. Based on the evidence-based medicine, all patients with cardiovascular disease require screening for diabetes. For this, an extended analysis with the determination of the 3 markers is recommended. This year, a long-awaited scale for assessing the risk of developing cardiovascular complications are presented to the medical community. Previously, diabetes was considered equivalent to coronary artery disease, and that patients were automatically classified as at very high cardiovascular risk. The SCORE2 diabetes score measures cardiovascular risk over the next 10 years in Europe. Since the study was conducted on European cohort, it is limitation of this score. Depending on the total score, patients are divided into 4 risk groups: low risk, moderate cardiovascular risk, high risk, very high cardiovascular risk. As a rule, patients with this category have atherosclerosis disease or severe target organ damage. The value of the total score also depend on the region of European region and gender. Regions also divided into 4 categories: regions with low risk, medium risk, high, and very high risk. For example, in countries with a very high cardiovascular risk, the likelihood or low and moderate risk is very low. So how is this calculated? For this purpose, the following indicators are taken into account: risk region, gender, biological age, diabetes age, smoking status, systolic blood pressure, total cholesterol, HDL cholesterol, glycated hemoglobin, glomerular filtration rate. In total, 10 indicators are required to assess risk. Based on this, the total score is calculated. For example, a man 53 years old from a very high risk region, diabetes discovered at the age 35, no smokers, systolic blood pressure 140 millimeter H, total cholesterol 5 millimole per liter, HDL cholesterol 1 millimole per liter, glycated hemoglobin 60, glomerular filtration rate 95. The total amount is 21%. That is a very high cardiovascular risk. Such a scale helps the doctors choose the treatment tactics, motivation of patients, and increase of patient adherence. Who need to determine a cardiovascular risk? Patients with target organ damage, suspected atherosclerosis cardiovascular disease, and with few risk factors. Another important issue is weight load in patients with diabetes, regardless of the presence of cardiovascular disease. It is recommended that individuals living with overweight or obesity aim to reduce weight and increase physical exercise to improve metabolic controls and overall cardiovascular risk profile. Glucose lowering medications which affects on weight loss, GLP-1 agonist receptors should be considered in patients with overweight and obesity to reduce the weight. Bariatric surgery should be considered for high and very high risk patients with body mass index more than 35 kg per quadrat meter. When repetitive and structured effort of lifestyle change combined with weight reduction medications do not result in maintaining weight loss. The recommendation once again recalls the classical concepts of revascularization in patients with diabetes. Another important aspect in the treatment of heart failure in patients with diabetes. CGLT inhibitors are recommended in all patients with heart failure with reduced ejection fractions and diabetes to reduce the risk of heart failure hospitalization and severe death. Sacubitril and valsartan or AC1 is recommended in all patients with heart failure with reduced ejection fractions and diabetes to reduce the risk of heart failure hospitalization and death. Beta blockers are recommended in patients with heart failure with reduced ejection fractions and diabetes to reduce the risk of heart failure hospitalization and death. So also we have a recommendation for patients with heart failure with left ventricular ejection fraction over 40%. Empagliflozin or dapagliflozin are recommended in patients with type 2 diabetes mellitus and left ventricular ejection fraction over 40% to reduce the risk of heart failure hospitalization and severe death. Diuretics are recommended in patients with heart failure and left ventricular ejection fraction over 40% and diabetes with signs and or symptoms of fluid congestion to improve symptoms, exercise capacity, and heart failure hospitalizations. The cardiological triumph of new glucose-lowering drugs can be characterized figuratively as follows. All roads lead to Rome. Indeed, in international recommendations, they play an important role in reducing the risk of independence from glucose control and reducing the heart and kidney failure risk. Very important the recommendation for multifactorial approach in patients with type 2 diabetes mellitus with and without cardiovascular disease. Identifying and treating the risk factors and comorbidity early is recommended. A multifactorial approach to management 2 type diabetes mellitus with treatment target is recommended. Multidisciplinary behavioral approaches that combines the knowledge and skills of different caregivers are recommended. Principles of motivational interviewing about should be considered to induce behavioral change. Telehealth may be considered to improve risk profile. The role of screening is very important in identification of number of disease. Given the high prevalence of previously undiagnosed diabetes in patients with cardiovascular disease and the increasing risk of complications, experts recommend the systematic screening for diabetes in all patients with cardiovascular disease. On the other hand, assessment of the risk and presence cardiovascular disease and chronic kidney disease is recommended in all patients with diabetes. Given the high risk of complications, screening for atrial fibrillation should be performed routinely, especially among people over 65 years of age. Finally, the patient's role in preventing complications. What should we know in terms of updated recommendations? The most effective model of preventive care is a total risk management approach aimed at eliminating the underlying risk factors. The patients should participate in creating a program for meal planning, physical activity, symptoms management, monitoring blood glucose level and other indicators. In this case, the patient becomes a key figure in successful control and self-management. Requires consulting with a plan to education of patients, increase adherence, set goals, implement then using proven treatments, supported by regular follow-up in persons or through the capabilities of technology. So, dear colleagues, I express my gratitude to you for your attention. I wish you success. Thank you again for attention.